Hi, folks. I'm Katie Dawson. I'm at Emmanuel United Methodist Church, and I was asked to help communicate how you might determine what your COVID-19 recovery phase is using some of the data that's available. So one of the hardest things that I know I've been wrestling with is that it is really hard to determine which phase you should be in. Where do we turn for that information? How do we use it to make decisions for our communities? So I wanted to share with you how I've been utilizing this information and share some best practices. And first, I think it's important to figure out what kind of numbers are we looking for. So initially, the guidance put out by our conference said we should look for a 2-week decline in numbers before shifting from a red to a yellow phase. The question is which numbers, right? New cases or deaths or hospitalizations. My congregation decided to take kind of an all of the above approach. We noticed that sometimes new case numbers would start to decline, but the hospitalizations and the deaths would start to increase. And so we decided that until all of those metrics began to decline together, that we would seek to do no harm and remain with our virtual and online options. Now, since then, there have been a number of other resources that have allowed us to really get a snapshot of our status without having to look at all of these numbers individually. And they also, what I appreciate is they provide for this standardization of metrics so that I can say, you know, these are the things that apply no matter where you are. These are the things that public health experts are recommending. And it really allows it to take kind of like my personal my own personal bias or my own personal interpretation of those numbers off the table. So the first one I want to share with you is actually the report from the White House Coronavirus Task Force. And according to the White House, there are a number of metrics, including percentage change in cases and deaths and skilled nursing outbreaks. We call them long-term care outbreaks in our Iowa data. But they utilize two numbers to determine the overall risk in a county. And those are new cases per 100,000 per week and the diagnostic test positivity rate. Now that first number, it's pretty self-explanatory. So whether you're in a large population or a small one, this allows for a kind of apples to apples comparison across regions. And the thresholds set by the White House indicate that if you have more than 10 new cases per 100,000 people per week, you are in the yellow zone. More than 50, you're in the orange. If you have more than 100 cases per week, you are in the red zone. And they partner that with the positivity rate. And the positivity rate, this has kind of been something you may not know very much about. It is the percentage of tests performed that have a positive result, right? A high positivity rate means one of two things. Either your community is not doing enough testing, and so only those people with symptoms are going in for tests, and so that would be one indicator. The other is that community spread is incredibly high. And so you want to get that number down by reducing community spread, but also by increasing testing. According to the White House thresholds, if your community has a positivity rate of greater than 5, you're in the yellow zone. More than 8, it's the orange zone. And if your positivity rate is greater than 10, you are in the red zone. Now, I want to note here that the Iowa standards being used within our schools is very different than what the White House and the CDC are recommending. Iowa is currently expecting we have a positivity rate of greater than 15% before schools are allowed to ask for a virtual waiver. I want to show you, this is the weekly report from November 1st. And this shows on one of the pages of the report, they list all of the counties that are in each of the red, orange, and yellow zones. You do have to look at the fine print, however, because only the top 12 are included in this section, but down here it shows all of the counties that are included in red. They only have room for 12 up there. I guess that's locality. Here's the counties. According to the November 1st report, 82 of our 99 counties were in the red zone. Only 5 were in the yellow zone, according to new cases and test positivity. Okay, so another resource, we've got the White House report. I've also been utilizing the Harvard Global Health or Brown School of Public Health report. They also have 4 risk zones. They use slightly different criteria. They calculate a 7-day rolling average of new cases per 100,000 people. So again, this is an apples to apples comparison. To compare these numbers with the White House metric, if you're looking at the average daily new cases, so this requires at least 25 or more. You take that by 7 and you get how it compares. So Harvard would say you need at least 175 new cases per 100,000 people to be in the red zone, and the White House would say only 100. So the White House is actually a more conservative guide for this. Now, they have this great risk map, and on the risk map, you can select by counties, so you can see the indicators by counties, or if you select by Iowa, then it pulls up this map for you very easily. And then if you hover over your county, you can see those average daily new cases. They also include some recommendations, very, very simple, basic recommendations. So according to the Harvard metrics, if your county is in the red, they recommend that you should immediately implement stay-at-home measures. And as of today, if you look at the map, every single county in Iowa is in the red, according to the Harvard metrics. One other resource we have available is the Iowa Department of Public Health. That's coronavirus.iowa.gov. And I have found that the Iowa reporting has not been the best resource for determining what level we're at, and that's for a couple of different reasons. First, there are no risk levels or phases like other states are utilizing. So you can't just look at the numbers and then immediately see, what phase you should be in. Second, it has not been entirely clear what methodology they're using for cases and positivity. And what I found is that the numbers reported here are often very different from the numbers we find in other places. Now, there's a couple of reasons for this. One is that the state is adding cases to their site based on the date of the test rather than the day the test is reported. So I want to actually just show you an example of this. On November 2nd, news reports said that there were 1,469 new cases. So that was just a week ago. And you get that new case amount based on the total cumulative positives reported today. So you could look at this total positive reported, something like that number today, and then you subtract the total cumulative positives yesterday, and that would be the new cases reported, right? The charts on the Iowa website, however, change as those tests are reported. So this is actually from a little bit farther down on that page. And if you look at this, you can hover over each individual bar graph, and you can see what the total cases are. So today, when I checked the chart, it actually shows that on November 2nd, there were 5,148 positive cases. And that was of the tests taken that day, 5,148 of them were positive. But that changes every single day. So something I have found is this line graph right here. That is utilized. This is the 14-day rolling average, and it's a far better indicator because it allows you to look back 14 days. So if someone took a test, you're able to capture what that average is, and it includes all of those tests that were added since the time you last looked. Now, before we had access to those other metrics, this is what our congregation was using. we were looking for this 14-day rolling average to go down and to remain down for 2 weeks before we'd consider moving from phase to phase. We've basically decided to pick one of those first 2 established standards that I talked about. I think determining which set of metrics you're going to use is really important, and it's a very effective way of sharing with your local community the risks. And it allows you to enact the levels of your response plan that are appropriate for each of those phases. So in my congregation, we've determined if the data indicates we are in orange or red, then we will remain in the red phase of our plan. Only when we've been in the yellow zone for 2 weeks will we implement the yellow phase of our plan. And if we move back to red or orange, then that immediately moves us back to that level. Now, in our congregation, we established a task force to write that plan and to make decisions about that execution. And then it was approved by our administrative council and communicated out to our congregation. It's accessible on our homepage, and we have a current phase of the plan we're in on that as well. And we've let the church know that if at any point we are changing phases, we will communicate that information back to them. I personally have found, as I'm thinking about sharing this data out with my congregation, the data tables from Harvard or in the Brown School are the easiest to access. You can go to the website, anyone can access it. It's color-coded and makes it very simple for church leadership to see that information. The White House Task Force report has not been publicly available. It's submitted to the governors of every state on Sundays, and then media sources are often able to access and then share the report by Wednesday or Thursday. And so when I find it, I've been trying my best to share this on the Iowa United Methodist Clergy page. And we found that by using these established metrics and recommendations, there's some clarity that allows us to determine which phase we should be at in our plan. I hope this helps. I hope it provides some guidance for you and your congregation. But if you have any questions, I want to invite you to feel free to reach out and ask, and I'm happy to help. Take care. Bye.